We're going to go ahead and get started. I'm going to go ahead and share my screen, and we are recording. Okay. Can everybody see that okay? You can give me a thumbs up. Okay, perfect. All right. So thank you again for joining us. Thank you. Thank you again for joining us. We are going to present, this is a really long title, but we're basically going to present on our COVID-19 messaging grant. And I am joined by my colleagues, Melanie, Emma, Tim, and Paige, and my name is Gabby. And we also have some additional team members who are part of the grant and part of the entire project. So we wanted to make sure we give them, include them on here to be able, because they were a huge part of this as well. And they come from different backgrounds, and so do we. So the objectives that we're going to cover today is we're going to discuss the project impacts and the grant preparation. And then these objectives come from the session proposal. So if we were doing this live, this is what you guys would have learned, but you're still going to learn this just, kind of on Zoom. So we'll, at the end of this, you'll be able to identify partners and innovative ways to reach target audiences related to COVID-19 prevention efforts, learn to develop these culturally appropriate projects and campaigns. And then we're going to go through an activity at the end. Melanie, toward the end, is going to talk about evaluation and what we evaluated and the results of that. And we'll share, we'll talk about the evaluation tool we used, and also we'll do an activity that is a grant and project preparation guide that we had developed, and so we'll do that together. Now, as you go through this, you're going to see these colorful little ads, and these are basically the images and the creatives that we used as we go through this and talk about billboards and flyers and magnets and all these things that we had done. These are the creatives that we had. So hopefully you'll enjoy some of these there. I'm not going to read the entire messaging, the COVID messaging funding announcement, but all of this is just here. We wanted to start out with this to give you an idea, to let you read through this, and so you can see what the funding announcement was when we were given the grant, and when we saw the grant, the funding announcement. And so one of the first things that we did, we wanted to look at what the key components of the announcement were. So we had taken this, it's pretty short, but what we had done essentially is we looked at which words kind of jumped out at us. What was this organization looking for? And so we didn't literally highlight, but we did look at and note what the key components are. So you can see the highlighted words. We had the campaigns. They were looking for campaigns. They wanted health guidance that was consistent with Utah Leads Together, which was a statewide initiative where the state had shared information and guidance and promotional stuff. And that kind of statewide guidance for the entire state of Utah, and then also Utah Department of Health. So we knew that the health guidance had to be consistent with the messaging that was already happening, that was targeted to high-risk populations, these specific target populations, and geographical areas of concern, and we needed to use existing and established channels or methods of communication, and that was encouraged. So we took this information, and then we determined, we asked ourselves, so what are the tools, services, and skills that were needed to be able to do these things? So, to be able to really to be able to answer the questions that the funding announcement wanted, or that the grantor wanted us to answer, and be able to implement it in that way. And then we looked at the actual application. It was an online application, had about maybe 12 or 15 questions. And so we looked at the information in the application beforehand. And again, just to look at and see what kind of questions were they asking? What did they want to know? And some of those questions, for example, like what Tim will talk about, we had to determine some gaps. So not only looking at health guidance consistent with the messaging and being able to push out the current messaging, but what are the gaps? What could extension bring to the table to make it unique and help it along. So I'm going to turn it over to Tim, who's going to talk about building our team.
Okay. Hey, thanks, Gabby. Thank you guys for being here. As we're thinking about building our team, we look for key components that are going to be part of our team. Who do we need to have on our team to make it be effective and be something that was going to be, well, first of all, get funded, and second of all, be able to do a good job as we went out to the community to do this. So obviously you can see we got people from marketing, community organizations, looked at some of the target audiences, message dissemination, and evaluation. We knew those were things we were going to have to put into the program, and then we also had to find people who could help with those programs. So directing tools and services and skills was needed. We did, obviously, with what we do with Extension, we always look for multidisciplinary teams with specific skills and connections. And with our groups, we have a lot of different people that have backgrounds in areas that some of us just found out about when we were looking for this grant. So we had some great ideas, good people, and those existing community partnerships obviously help widen our impact and our reach. So we go to gaps, as Gabby briefly mentioned. What could we do with this grant? And actually, before we even received the grant, as we were looking at it, we investigated some of those areas that we wanted to look at. For example, what was online currently? What did Utah have? What were they looking at? Was the Department of Health looking for? Or some of the other areas that we need to look at to help this be an effective program. So again, what does USU Extension bring? What are the gaps in the messaging that existed? And one of the things we looked at initially was there wasn't a lot of mental health information for certain target audiences online that we found. So we knew those were some areas we wanted to look at. And I think it was kind of an interesting way for us to look at this differently when we think about grants and what we want to accomplish. We're lucky enough to have some time to look at those grants before we apply for those to see what would be appropriate for our skills and abilities, especially with the people we have. So I'm going to turn over for Emma to go to the next part of our campaign.
Okay, make sure I'm unmuted. Yeah, so it was an important part of this grant to partner with a marketing firm in Utah to, first of all, discuss how we wanted to disseminate and communicate these messages, right? They are experts in that field. So it was a very important partnership for this grant. And due to that tight turnaround, as well as the time frame, we decided to focus on holidays or seasons to bring these messages about. I'm sure as you've seen, it's even timely right now. We're kind of in that same time frame. We had some fun Thanksgiving themed, general winter, as well as those other holidays. And so you'll continue to see those throughout the presentation, as Gabby had mentioned earlier. So that marketing firm not only helped us come up with these messages, but they also helped us to create other creatives. They helped us with flyers, posters, magnets, social media, online campaigns, billboards, a lot of different ways to get this message out. And now through meetings and partnership with this marketing firm, as well as our state SNAP Ed program, which is called Create Better Health, we learned that the channels that we were using were the best ways to disseminate our messages to those audiences. So those high transmission areas of groups that are at highest risk of COVID in Utah, we found out that what some of those best ways were to get their attention and see these messages. And another important thing to note here is that the channels that we did use, they were essential services, or most of them were essential services and businesses where people were going to either receive essential services or information throughout the pandemic. So for example, we used radio. A lot of folks tune in to find out what's the latest, what's going on. And then we also had some of our materials in Latino grocery stores, as well as just regular grocery stores in general. Folks are going there for supplies. We also had some creatives in public transportation. So again, just a big focus was using these essential services and businesses to get that message out. And I didn't mention, of course, social media. Social media was huge, especially during the pandemic. It was one of the main ways a lot of us stayed connected, right? Especially with social distancing and working from home for many of us. And all that to say is it's really focusing on that idea of going to where the people already are, right? We don't want to go into a space and try to bring them to us. We want to go to where they already are so they can receive this message and hopefully bring more awareness to their mental health throughout the pandemic. And I'll go ahead and pass it along to the next person.
Okay, and so as we all know, as extension professionals, having partnerships in our programming is essential, because having good partnerships is the key to having successful programs and impacts. So just as every good extension program, we looked at what partnerships could be used for this program. These partnerships helped us find the gaps and fill them in, just like others have talked about before me. They helped us find the good communication channels to go through. They helped us find what was needed. And partnerships were just a very, very valuable part of what we were trying to do. Due to major case numbers, one of the vulnerable audiences that we targeted were Navajo Nation residents living in San Juan County, Utah. So partnering with community organizations was really, really helpful in this endeavor. I'm the extension agent down there, but I'm not that culture and I'm not part of that community. So it was important to find different organizations that could help us. So one of the organizations we partnered with was called Navajo Strong, and they made it possible to make sure that our resources were culturally appropriate so that we had correct translations, the visualization was a little bit more culturally relevant, and that we disseminated this in a most beneficial way, because as Emma talked about, they used a lot of social media channels and things like that. But for those residents, that's not really a great way to get out information. And so again, these partnerships and this community partnership with Navajo Strong showed us that maybe social media wasn't the best place to do that. So as you can see, here's some examples of the flyers that they helped us create. And with their partnership, we decided to mainly do print materials and mailers for our Navajo Nation audience. And so they were able to take our print resources and put them, as you can see in this picture here, in their supply boxes that were going to remote locations throughout the Navajo Nation. So we were able to get our reach even farther with this partnership. So it's important to have partnerships when doing things like this and have steady communication with them. And again, they can help in creating things and in disseminating the research. And now I'm going to pass it along to the next person.
Thanks, Paige. So as Emma mentioned, the awareness campaigns that we learned best practice from our SNAP-Ed program, and they're actually fairly difficult to evaluate for behavior change. And even kind of a little difficult to evaluate on even just awareness beyond reach, but we really wanted to try. So we did use best practice for awareness campaigns by designing the survey to include images from our campaign and basically asking, have you seen this? Have you seen this? Have you seen this? And I'll show you an example of that. And we decided to try to capture more than just reach and engagement. And we kind of had to as well from our grantors. They were requiring that. So we created a survey to assess attitudes, awareness, and behaviors regarding the state and CDC guidelines regarding COVID. So, and that we did disseminate this through the Qualtrics research services. So basically Qualtrics, I think most of us know that as a survey platform where we can create surveys, but they also have this research services arm that they will actually provide you your sample as well. So they have people who, get paid after so many surveys, they get incentivized to take surveys in general, and they have this pool of people all throughout the country. So we basically limited that. We needed people in Utah who had lived in Utah during this campaign. We needed people who lived in those high risk areas. So we were able to say, do you live in Utah? Do you live in these areas? And to determine that. So the next slide will show a couple of images from our survey. So on that left side there, you see, have you seen this ad? So we had about 14 questions with the 14 different ads we had asking yes, maybe, or no, had they seen that? And then at the very end, we had two matrices. One would show up if they had never seen one, basically saying, based on seeing the images for the first time in the survey, please rate how the ads and images affect your thoughts, actions as listed below. And the other one, if they had seen them, would basically say, based on seeing this previously, please rate how these images affected your thoughts, actions, and feelings on a scale from 1 to 5. So we were asking about their awareness of COVID concerns, their attitude towards the safety guidelines, if the ads encourage them to adopt practices to improve their emotional or mental health, or if the ads encourage them to adopt practices to reduce their risk of contracting COVID. And what we found is that, well, we had, I think, about 398 people take the survey, and 325 of those qualified for the survey, meaning they lived in Utah during that time, and they lived in those areas of the highest risk that we were targeting. And the majority, about 63%, saw at least one creative before coming to the survey. And the results also showed that the messages did increase attitudes, awareness, and behaviors related to emotional mental health. And then we had significant results in two specific areas. So an independent samples t-test showed that the significant differences were between those who had previously seen at least one creative and those who had just seen them for the first time in the survey, which kind of shows, that they saw them previously, and maybe they were able to think about them and see them more than just seeing them one time and being asked these questions. So those two areas where it positively impacted their attitudes towards the safety guidelines, which is great. That's one thing we wanted to do with our awareness campaign, was to, help people to say, hey, this is helpful, it's not harmful, it's going to help you and your families, and just to, improve that attitude towards it. And then the other significant difference was also that it encouraged people to adopt practices of the COVID safety to reduce the risk. There weren't any additional significant differences compared to that matrix we showed. And regressions also showed that regressions were also conducted to control for differences of race, gender, county of residence, and no differences were found in there. So in kind of summary, we have been talking about preparing, or how we successfully prepared the grant, executed the grant, and evaluated this grant in such a short time frame. And we'd love to be able to share with you a tip sheet, which we'll go over next, to get you in that same feelings for a program you might have. So the first thing we did, and that you can do too when you have a grant idea or a grant proposal available to you, is start with that funding announcement. What are those key components of the announcement? What tools, services, and specialties are needed? What are they specifically asked for? And if you notice in that first slide from Gabby, she had highlighted those and made them different colors. Do that same thing if you need to make that really stand out for you. What information are they actually requesting? And then develop your team based on that. Be very intentional about the skills you need to bring to that funding project, including the skills you have yourself. And what skills and connections can they bring to make that a strong proposal? What existing partnerships do you have, and what resources are at your fingertips? Or what partnerships are you going to be able to easily build and bring to the team as well? And then build marketing and evaluation services into your budget. It was so great to be able to just have the payment for Qualtrics research services built into our grant. We knew an estimate of what that would be. We built it in, and same with the marketing. Obviously, that was a huge piece of our grant, was paying an outside entity to basically do the graphic design and the execution of these things. So make sure you're including those in your grant. Let that grant pay for it to stretch that even farther, and don't discount the role that marketing can play. Even though this was kind of a marketing campaign in general, I think in a lot of our extension programmings, we overlook the role that marketing can play. So I'm going to turn the time over to Gabby, who's going to lead us in an exercise.
All right, thank you all. Thank you so much. So I'm going to go ahead and stop sharing so that I can move over to our activity. Emma just put the link into chat, where you can access the activity document as well. And this way you can download it anytime you would like. You can go ahead and download and save it, but I do have it up here, and I'm sharing the screen so that we can go through this together. And what we'll do is we'll go through each component. Each one of us will kind of take turns on a couple of these components, and then we'll ask you to write. We'll go through some of the examples that we wrote, and then we'll ask you to write your own project grant needs in the chat. This is kind of the part where you listen less to us and we want to listen to you more. Basically, we stop most of the talking, we try. So So the first thing I wanted to at least kind of start with, again, looking at, consider a grant that you're applying for or a project you would like to start. And what are the key components of the grant or project? If you have something in mind, go ahead and, you could type it in the chat. What are some of those things that you have? And I'll ask my team to monitor the chat, just because I can't right now without, I don't know what Zoom will do. But what are some things, what are some key components of a grant or project that you would like to start? And if you have the document in front of you, you can highlight those words and phrases, circle them, whatever you would like, underline them. And then based on those key components, what are those skills, tools, and services needed? And with the rest of this document, with these common components of a grant or project, and including these examples to help you, will hopefully help, this will hopefully help you get to a point where you can have something that's a little well-rounded and thought out. That's one of the biggest things, is just to be able to think of how can my grant or project get what it needs to get? How can I make sure, to kind of have all of my things covered? So I wanted to turn it over to Tim. He's going to start with the marketing part, the marketing line, and then we'll just kind of go through it together.
Yeah, perfect. Thanks, Gab. Yeah, as you see this, we're talking about marketing first. Obviously, questions that we had to ask and that we'd like you to ask is, do you have an internal marketing department? What services do they provide? So for us, the example is we have USU Extension Marketing, who actually does quite a bit of work for us, and opportunities for us with them include magnets, creation, printing, branding approval. Much of what we do has to go through marketing before we can get it out into the public. But they do social media, Facebook, Instagram, Twitters, all these things, and help create websites, and just general management of activities we're doing outside of the university. So that's really a great thing for us to look at as we're talking about questions. The second question, of course, is, do you have external contacts in marketing or advertising? And then what services do they provide? For USU Extension, we had the Utah Media Group, and they were actually great to work with. They had done stuff before with news sites, marketing, billboard, bus ads, all those kind of things, media boosted posts and Facebook. They really knew what they were doing, so it was really helpful to work with them to do some of those things that we couldn't do individually. So I think, as some people had said, having the funds available for that external group really made a big difference in what we were able to accomplish with this grant. So we're going to ask you what your grant and project needs might be in that area. I mean, you're welcome to put it in the chat, or we can do it all at the end, however you think it works best. But I don't see anything coming in the chat that I can see at this point from that. So maybe we go to the next one. I think Paige is doing our next one.
Yeah, so in these projects that we're doing, again, it's important to think about our partnerships. So our community collaborators, our key leaders, and our key stakeholders. Gabby, can you scroll down just a little bit more? Thank you. So think about who are your current community collaborators to help meet the objectives, or what relationships need to be developed to meet these objectives? Who do we need to have at our table to be able to get our projects and our programs to go? So some of the things that we had were Navajo Strong, Areas on Aging, the AmeriCorps Seniors, Extension, county health departments, things like that. And the needs that we had were connecting with a caregiver network, the Latino community, and the Navajo community. So again, maybe if you want to put it in the chat, who's currently at your table and maybe who's not at your table that you might need as far as community collaborators, key leaders, and key stakeholders. So Sarah put in the chat, similar to our examples, we have an internal marketing team that can help out with some things, but it's definitely helpful to find external people who can reach a wider range of people or different groups that we don't normally reach in Extension. That's really good. I find in my county's huge. And so if I'm not working with people to reach all audiences, I never will. And so it's really important to find those people that are reaching the audiences that we don't. And then Melanie put, another way she looks at collaborators is, how can I help another agency? For example, after school groups always need activities and ideas for youth. That's a really good idea. What can they bring to your table and what can you bring to their table? Exactly. Look for ways that you can help and have a mutual relationship. Because if you're willing to help them, then they're going to be way more likely to help you. So thanks for putting that, Melanie. Does anybody else have anything? Who might they need help from, or what areas could they use for community collaborators and key leaders? Me, an example that I have on my projects, again, working with tribal communities, it's really a lot easier for me if I have somebody from those communities. So I always look for people that would be willing to help me in the programs that I'm trying to get into those communities. So again, really, really important to have those partnerships, because we can't do it all and we shouldn't be doing it all. We should ask for help and we should be willing to help others. And then think about our target audience. Who is or is our target audience? For our project, we were looking at those populations that had been affected most by COVID, and then those that needed the information the most. So that was seniors, caregivers, Latino and tribal communities. And we had 9 counties identified as areas of concern due to high transmission rates. So we had a really good makeup of what our target audience would be. So again, in programming and in projects, think about who you're trying to target. Does anybody have any ideas of who they would want to target with their projects? Again, you can put that in the chat if you have something specific. That's awesome, Dawn. She put sugar sweetened beverage reduction campaign for parents of young children. Again, that's a great target audience. You've really drilled down to what you're trying to do. That's awesome. Thanks for putting that.
And actually, let me add something that we didn't put here for the target audience, but one of the ways that we ended up reaching, we wanted to reach parents. And so we had worked with a statewide, it's a statewide online message dissemination thing to parents of school-age children. It's called Peach Jar. And we were able to target specific school districts within our target counties. And that's how we were able to reach families of younger children, especially at that time, this time last year. You know, there was that huge, it was, you could see the high transmission rates in schools and among teachers, among, caregivers and youth as well. And so we were able to reach them as well. So that's another way that we had targeted them.
Thanks, Gabby. And Tim put in the chat, youth mental health was also a big thing at this time for programming. Sarah put collaborators for one project I'm working on. We are helping by facilitating conversations and making introductions for groups who are doing similar work. That's awesome. Just finding those who are doing the similar work. Sometimes we don't have specific programs that we can bring to the table, but we can still help by bringing groups together to work toward a common goal. That's awesome, Sarah. That's really great. Sometimes you may not have a good program or something right then, but if you're working towards a common goal, you can definitely help each other and they can help you. So that's great. I'm going to turn it over to Emma and she's going to talk about message format and dissemination.
Okay, so with message format and dissemination, some questions that you can ask yourself is what messaging formats does your audience utilize the most? And what forms of message dissemination work best for your target audience or those audiences. And as Paige mentioned earlier, for those tribal communities, social media really wasn't the go-to for that community, whereas for seniors and caregivers, that worked really well. So it was really, again, relying on those partnerships, what we already know for the tribal communities, what works. So flyers, posters, mailers, community events. And then something else I wanted to mention too about the messaging and format of the messaging. I am sure you noticed that a lot of the photos of these materials were really playful and they were really light. And that was something that, and correct me if I'm wrong, Gabby, that's something that we talked with the marketing firm. That was something that we wanted to keep in mind, right? Everything else was a little bit more heavy at the time. You know, we were very aware of what the other recommendations were from the CDC, and they were just very, very to the point. So something with these messages is that we wanted to keep it a little playful, while connecting it with that really important but short message. Anyway, I wanted to plug that in there. But yeah, some other ways that we targeted some of these populations, for example, seniors and caregivers, there are some coalitions throughout the state, or for example, food pantries that put together pantry boxes. And so we were able to put magnets in those so they would reach families, flyers with some caregiver baskets as well. So really, I don't want to say it's out of the box, but really just thinking past what's the norm for marketing. How can we get these to the people? So anybody have any examples for messaging format or dissemination? All right, thank you for sharing, Sarah. So infographics have been a huge ask within the communities I'm working with for COVID-related messaging due to low literacy. Yes, that's great. That's something that we definitely need to be keeping in mind is what is that literacy rate? Infographics are really handy. Not only are they eye-catching, but they're super simple, right? We don't have to go into this really long explanation of what we're trying to get across. Infographics are simple, pleasing to the eye, and really easy to get out. So thanks for sharing, Sarah. And if there's nothing else, I'll go ahead and pass it along to the next one.
Okay, so evaluation. Within your extension services, do you have an internal evaluation specialist or provider or someone that can help you develop an evaluation? Or can you write that into your grant that you can, pay and outsource for that help if you need it? But even more particular, like what are you assessing? How can you obsess? How can you obsess over your objectives? How can you assess your objectives? And sometimes that takes some thinking, and I think we get better and better at it the more we do it and the more we have success with some evaluation tools. So that would be one thing I would suggest is look at those objectives that you are putting out for your grant. What exactly are you hoping to measure? Is it possible to measure that? I think sometimes in extension, especially with human sciences that we're all in with family and consumer sciences, it's really hard to show like long-term impact because what we're hoping for is like greater societal change that will make families stronger and all of us healthier and live happy, long lives. And that's kind of hard to assess. But what can you assess in the meantime that is showing trajectory towards those greater impacts? So I showed you examples in our presentation about how we assessed this awareness campaign and took it a tiny bit farther just to see what we could get out of it. And it ended up working pretty good for just doing an awareness campaign beyond the reach. So examples we did actually, and I didn't mention this in our presentation, but we did create our Qualtrics survey in English and Spanish. And we also told Qualtrics Research Services that we wanted to have at least 10% of our survey participants be Hispanic because that was more reflective of our target audiences as well, which happened, which was great. So we did create it in English and Spanish, and Qualtrics, we contracted with Qualtrics to disseminate that survey and kind of do that reach for us. We did have an internal evaluation specialist and analyze the data for us. So that was super helpful. And of course, we were hoping for changes in attitude and awareness. And of course, our overall huge impact was that we could reduce the COVID rates, but we didn't really have a way to measure that. And to tie reduction in COVID rates, which didn't happen because they just kept going up till vaccines came, of course, but to tie that to awareness campaign is pretty much impossible. But what could we measure? What could we assess that showed the work that we did? What examples do you have of past work you've done or future work you hope to do of things you'd like to assess or the tools you plan to use to help you get that assessment? If you have any ideas, you can put those in chat. And I know it takes a second to like put it all in chat the way you want to put it. But one thing I found to be helpful is, how did you, or, what was your knowledge or understanding of this topic before you came to the program? And now after, what is your knowledge and understanding? And it's great and fairly simple to be able to compare, a 5-point scale of those two things. That's a pretty standard one that I use in almost every program I do. And it gives you those numbers that are a lot easier to crunch than just, statements from people. I see a comment in chat, we're using focus groups and interviews to collect data for a project. That's great. Those are super helpful in getting a program started and analyzing what you need to know or even evaluating afterward. And oftentimes that takes money too, right? So hopefully you can write those into your grant to recruit the people, feed them while you're there, give them an incentive to complete that focus group or whatever. So great example there. Okay, next.
Right, and we were, I think, when we first started, we were thinking about doing some kind of a focus group or something like that. But one thing that I didn't mention, and I should have mentioned at the beginning, was this entire grant project that we're talking about was from September or like September. By the time we started the campaigns and all that stuff, it was really October through December of last year. So we really did this campaign, this entire thing in 3 months. So we didn't really have time for a focus group. And that's why we had put such a huge emphasis on meeting with different organizations and meeting with our state SNAP Ed, our Create Better Health, and faculty and just different collaborators to kind of do what we wanted to maybe try to achieve with a focus group, but we just didn't have time for that. And then something else that I didn't mention at the end also was that we did, through all of these campaigns that we did, we were able to reach almost 3 million people within those 3 months. And that was a huge success for us and for such a limited time frame. And again, it was because of those partnerships and because of the marketing component and all of the different unique ways that we were able to kind of push out those messages on those billboards and bus ads, mailers and flyers and things like that. So the last part of this, this is in no particular order, but we did, there is a huge, when you work on a grant, hopefully you'll have some collaborations, internal collaborations with your faculty who you can reach out to, to be able to partner with on this grant. So, and I know we have about 4 minutes left, so we're going to go through this a little bit quickly. But which faculty can join your team who can contribute within those, who can contribute to those grant components? So like with marketing and community collaborations, target audiences, we just kind of took those components and put them in here, the ones that we talked about. And so the examples that we gave, I kept it kind of vague because it wouldn't really help you to put, our names in here or our partners in here, unless you know those people, but we didn't feel like the names really would mean anything. But our USU marketing team included, we had three people from USU marketing. We had Cynthia Lyman, Mike Whitesides, and Dennis Hinkamp. They helped, and also they have staff who helped create flyers and messaging and the kind of do the designing of that and all whatnot. So we did have those folks on our team. And then within working out our community collaborators and target audiences, we worked with our USU extension specialist. So Selena Willie, she's also the Latinx community coordinator. She works with SNAP Ed as well, the Utah SNAP Ed. Melanie also has that, Melanie on our team also has that experience as well. And so we have in our county extension faculty, so Emma and Paige, they had, and then Teresa Hunsaker, they were all really key and instrumental in connecting us to the seniors and caregiver organizations, as well as Navajo Strong and those community organizations. And then we did work with USU marketing and faculty to work on the messaging formation and dissemination, and our evaluation was through our county faculty and extension specialist who was able to evaluate that. So, think about when you look at your components, all of these different components, and you can add your own depending on your needs. Think about specific faculty who would be able to you can plug into those components and who would be willing to collaborate with you on that, including specialists. Okay. So I know that we only have about 2 minutes left, but I'm going to go ahead and stop at this point, and just to give you all a chance to ask any questions that you might have before our session ends. And we really do thank you for joining us. Do you all have any questions? And you can unmute yourself if you do, or you can write it in chat, whichever you feel comfortable with.
I have a question. So you were using Qualtrics survey for your evaluation. We are also using another one like MS forms for our evaluations. But I just want to know what was the response rate? How many people were responding, or what percentage of people were responding?
Yeah, we had 398 start the survey, and then only 325 qualified and finished the survey because they didn't live in Utah, or they didn't live in Utah during the time frame of their campaign, or they didn't live in one of those 9. We only have 29 counties in Utah. So, if they lived in the other 20 counties that we weren't really targeting, then they didn't qualify to finish the survey. So, yeah, that's what we had.
The response rate was very high though. That's good. But it did not happen to me. That's what I was asking. It was hard to get hard to make people to respond to online surveys.
Yeah, it is hard. And, in other programs we have, sometimes we'll incentivize those with a drawing or a prize of some kind. But Qualtrics Research Services just has that built in, and they'll just keep recruiting people until they fill the quota because we're paying them for the quota. And so that's one benefit of paying, something like research services for that help. And of course, if, there's obviously a bias with that, and we'd have to write that in that, it's a research services has a convenience sample in one way.
Okay, so you're using the Qualtrics, that's specific for, they were helping you with that.
Yes.
So it's, for me, that I was sending the surveys to, participants. Yeah, it's just for our program. So.
Yeah, and I think we've all done that. This was actually our first time as a team, any of us using Qualtrics Research Services.
Mm-hmm.
So we've all been in the boat of, we have a survey we're sending out, but this was the first time that we had ever contracted them to use their own sample and to fill that quota. And I would definitely do it again in the future on a grant. It was very convenient. It was very nice, especially if the main point of our evaluation was to report back on the grant. And that really was the main point of our survey, was to be able to say to our funders, here's what we did with the money, and here's some of the benefits of it. So I, in future grants that I write, I'm probably going to plan money for Qualtrics Research Services, if not for evaluating the program, then for the pre-planning purposes of being able to grab like a focus group of what people want to hear, how they want to see it, that kind of thing.
Well, thank you. Thank you for the information. Probably I will use Qualtrics too in the future. Thanks.
Yeah, it's great.
Thank
and
you.
If you've got the contract with it for your university, you probably have a specific person to reach out to and talk about. But super great question.
Thanks.
And I see somebody asked, how did you recruit for the focus group? So we didn't specifically do focus groups. We wanted to, but by the time we were told we got the grant and had to spend it, we only had like 8 more weeks of like executing to get it all done. So we actually didn't end up doing focus groups, but our Utah SNAP-Ed program will do them often, and they'll recruit through SNAP-Ed participants and people, and actually not just that, but they'll target low-income collaborations and community groups. And somebody asked if we plan to use some of the messaging materials again this year. I don't think we've even talked about that as a group, have we? Maybe we should.
Ready, and they have, now we might have to redo them because of new branding guidelines that the university went through, but they are ours. I mean, we can still use them, and we would just use them. I mean, we would use them outside of the grant because the grant really was only for 3 months. So, but we can still use the messaging, those, and the flyers and all of that stuff. We could definitely still use. All right. Well, we really appreciate your time again. Thank you so much for joining us. If you are interested, we do have a list of references. So one of the big things that I wanted to point your attention to is our SNAP-Ed, our Utah SNAP-Ed program, or Create Better Health program, had created a best practices guide with how to encourage, that talked about like social media and how to disseminate information, what was the best way. So this was also this was something that they had done recently, with a few months before we had met and started the grant. And so we were able to have, they had some really good, very updated new information that they could share, that again went toward kind of those messaging strategies that we ended up using. And then some other references and things like that. So we really appreciate it. Thank you so much. I'll go ahead and stop sharing, and I will stop recording.